I'm not the house of cards that falls down easily. Oh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin and Rachel Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Hi, everyone. Kristin and Rachel Walker here, and we are doing one of our mental health business shows. Our guest is Rachel Wilson. She is the chairwoman at Omnis Health Life and Wellness Center. Rachel, thank you so much for coming on the show.
No, thank you, Kristin. I am really excited to be able to talk to you. Read so much about you and has been highly referred to speak with you as well. So I'm glad to be able to speak to your listeners and share, hopefully, any insights that can help them on their journeys in this industry.
Absolutely, because it is a journey, isn't it?
Yes, highly is a journey. Lots of bumps.
Yes,
Lots
exactly.
Of, getting hit with sticks and everything else.
Yeah, how have you fared? Well, you know, I have like 12 questions right out of the gate. But first, I want our listeners to know a little bit about your background and what the organization is, so they know kind of, you know, the structure of where you're coming from.
Yes, of course. So a little bit about me. I am definitely a family girl, daddy's girl, mama's girl, and I actually am an Army brat. My father was in the Army, in the military, stationed out in Germany, Kitzingen, Germany. We were in the Harvey Barracks out there, lived there for a little over 9 years. And then we moved to the States. He was a serial entrepreneur, and so I have always had that bug. I actually went to a all-women's college in Decatur, Georgia, called Agnes Scott. So go Scotties, and did economics and business there, studied abroad in Japan for about 4.5 months, worked with my father a little bit in a supply chain business and got really interested in operations and supply chain. And so went to Georgia Tech to get my industrial engineering degree. From there, I got my master's. It was an international business industrial engineering master's, and was able to parlay that into lots of different industries. So my background is very diverse, to say the least. So I've been in procurement to working in logistics. I've worked with high net worth individuals out in New York City, been in wine and spirits. And now I am working with my family at Omnis Health Life Wellness Center, which is a fully integrated behavioral health treatment center dedicated to addiction and mental health treatment. And we actually want to kind of be like the Kaiser of the addiction space, where it's an all-inclusive environment for those particular treatment types, to include primary care in there as well.
Okay. So why go, I mean, so varied of a background, why go into the mental health addiction world?
I think for me, it really was not an immediate thing, to be honest. My father, as like I said before, is a serial entrepreneur. and he's had more experience with veterans who've had issues with mental health challenges and addiction. He himself has had mental health, challenges as well, not addiction, but he understood it, and he's seen people either die from that or been highly affected physically by having those challenges. And so, he really wanted to do something that was impactful to his community. As an African American, coming from 1960s, the segregation and all the things that he's experienced in his life, and then being in the military and what that meant and some of the challenges of what he had to experience with not even getting all of his benefits to help him with his physical ailments. He's a 100% disabled veteran. If you look at him, you wouldn't think so, but he definitely is. And I was actually working at Combs Wine and Spirits at the time when he had approached me and said, "Hey, I'm doing something more so in the laboratory space of consulting, but I want to develop a treatment center dedicated to people suffering from addiction and mental health. I need your help. Would you come down to Atlanta and stop the Can't Stop, Won't Stop dancing with Diddy and see if you come down to Atlanta?" And at first I was like, well, I'm not really sure, what does this mean? What is this going to be about? Will I really be able to help people? Like, I love to meet people and just get out there and be in the field, and really be impactful. And he said, I'm telling you, you will. And I really loved what I was doing. I really loved the people, but the impact that this can make, I really felt this could be something I can get more information on, because I see how the opioid epidemic has definitely impacted a lot of people, especially within disenfranchised, places, especially like where we are in Baltimore. Right. So that's how I came on board, and I've met some amazing people. I love our team. I'm biased, but I would say we have the best treatment team in all of Baltimore, probably all in Maryland, I would say, and patients see that. And I'm really proud that I've been able to at least put a little small stamp on this mission.
So how is it that you function where you're in Decatur, Georgia, which is near Atlanta, one of my favorite cities on the planet, and the treatment center is in Baltimore?
That is a very good question. It is a challenge, that is for sure, because, with our center, we also have not just the clinical therapeutic services, we also have medicated assisted treatment. So for those who are not aware, and I would think most of your listeners are, we also provide medication like methadone or buprenorphine, soon to be Suboxone, and looking into other drugs as well. Naloxone is something that we also can offer too. And those are very regulated drugs, and the DA is very particular about who can order it and how you can order.
Tracking dosages, all that. Oh, yeah.
Yes, the 222s. Yeah. So has been very challenging, but I think what has worked best for us, and this is where my industrial engineering and operational experiences come in, is systems and making sure we have the right policies and procedures in place. So that is ubiquitous across all the different program types that we have, service offerings, and as we grow and then want to do an Omnis 2, 3, or whatever, across the board, we have the same level of processes. So systems have been very helpful, from minimal things like Office 365, to the certain EHRs, or just even ourselves just creating a work plan of, okay, on these days and on these times of the month, this is when we need to regroup or send out things to make sure that we're consistent on, the documentation and paperwork. And staying compliant.
Right. It's a lot. That's what's interesting and why I wanted to talk to you, because you're new in opening. Wasn't it 2018 when you opened?
Yes, exactly.
Yeah. So you're newly opened, and I've been in the healthcare sector, especially in mental health, for a long time, and so I've watched some things go on when it comes to the addiction treatment world that you guys, maybe don't have to deal with. I want to ask you about that. But when I jumped into it, addiction was segmented off as something completely not under the mental health umbrella in many, many ways. So there was this whole world of, in fact, I would even have people, I'd be at a conference on addiction disorders and mental health, and I would ask someone that runs a treatment center, well, do you want to come on my mental health podcast? And they'd look at me and say, why would I want to come on a mental health podcast? We're about addiction. So, this is years ago. And now that just never would happen because, people realize, and I kept banging the drum too, of it's all under the same umbrella.
Yes.
But I saw a treatment industry, and it's part of why it's not the only reason, but it's one of the reasons why we have this opioid epidemic that we do, is because there's a lot of shady stuff going on in the addiction treatment world. And a lot of that's, they're working on, it's being worked on to be cleaned up, but it's a slow process. So what have you guys seen being this new, coming into that world, that you kind of had to take a pause on, or that you've had to work through because of that sort of lingering yuck? And that's a very juvenile word to use, but you know what I'm saying, that comes along with being not just mental health, but also the addiction piece.
Well, for us, we started providing treatment as of late 2018, but we had opened the business or started the business back in, I want to say November of 2016. So that's basically 2 years of not, really seeing any kind of recoupment, because there was so much needed in terms of the regulatory space, making sure that the community was okay with you being there. Because again, there's a lot of stigma around medication. Most people, or some people, I would say rather, are more familiar with detoxing. Go to a space where you get therapy, and they try to wean you off of medication or any kind of drugs, illicit or thereof. And we believe to meet people where they're at. So if they feel that that's what they need, just like if you go to a doctor, some people are more holistic and they're like, look, I don't want to have any kind of, medication. So can I do acupuncture or other things? We want to be able to be that source as well. So whatever type is that you're needed. But it took us some time to get to that space with the regulation. Now the challenges, oh my gosh, that was a lot to do with more so the people that, you meet along the way. We had some horrible consultants, people who were taking documentation maybe from places that they were employed, and then they would then give us their, policies and procedures, making us pay thousands of dollars for those things, to doing research or being referred to certain EHRs, in which we've spent hundreds of thousands of dollars on, to not even be able to use those things. So a lot of bumps and mishaps that happened along the way until we could finally get a chance to actually open. On top of that, we're in a state where it's a public, private partnership, and we are a privately held company, not a nonprofit. And with that, the state is saying, well, no longer are we going to accreditate people directly. We need you to go through some other agencies. And one of those agencies is CARF, There's a few other ones, like I believe JCO and COA and another one that's out there that you can choose. We chose to go with CARF, and CARF is also a very long-gated and it can be a elongated process. And unfortunately, again, there was 2-3 other people that we engaged. Like, hey, can you help us with policies and procedures? Can you help us to do X, Y, and Z? And didn't help us pass. Even though they were like, oh well, I'm a CARF surveyor, so of course I know what you need to do this. And you pay those people, and then what you pay for, you don't receive. Yeah, so it's not recouped. So there was a lot of that in that 2-year period that we had to go through, and eventually it just became, we're just going to have to bog down. And although we have to wear all these other hats, we're also going to have to, i.e. Rachel, we'll have to learn every aspect of what it means to do this business. So although I'm not a licensed counselor, I gotta be counselor, I gotta everything.
You got skills that counselors, that's not what they go to school for. That's where
Correct.
Me being in the EHR world was really helpful, because I'm not in the counseling world, but I could speak I could speak to a counselor about the technology, because I was such a great patient of counseling services, and I knew technology and know it well enough to be able to speak to a programmer. And because the programmer directly talking to a counselor does not work usually.
No, it doesn't. And that's why we originally engaged, some of these consultants. And there was one in particular, I remember, we were looking out our window, and like I said, we're in a disenfranchised location, and there's also a school that's not too far away, and unfortunately there were some things happening with some of the children outside of the building across the street, not on our property but across the street. And the consultant was talking to me, but he was looking out the window, and then he said, I can't believe these N-words are acting this way.
Wow.
And I was just like, wow, to one, be in my presence, as just a human being, and, to look at me and say, oh, well, you're okay. You're a good Negro. So so I don't need to say that to you. But these other ones, because of, I don't understand what they have going on at home, or what could be affecting them systematically or educationally, to be acting out the way that they are, that it's okay for me to call them out of their name. Needless to say, that person no longer was working with us, after those moments. But those are the things that you encounter and see a lot, unfortunately.
Oh yeah, and I think I won't tell listeners because they already know the story, but I shared with you the person telling me that I didn't have what it takes to run a network, right?
Yeah.
Yeah.
Exactly.
You're like, you're in the field and you just said that? Are you kidding?
Right.
So a sidebar on that, because I have a question. So, after Me Too, and obviously things have been going on forever. I love it.
Yes.
When and I don't want to make this a race thing on any side of the fence. So let's just say, just make it a man thing, okay?
Yes.
That was Me Too as well in their own way, but we can agree that men of a certain type can, be the impetus or the creators of a whole host of issues and not understand or be willfully ignorant about what they're doing. So when it comes to that kind of a situation where you are speaking with someone, they're saying this, and there seems to be this cultural bias, and it doesn't matter what culture, it doesn't matter what race, whatever it is. It's like, if you're this, and I'm this, then I can say this very derogatory thing, and it's okay because of what we are. And I think if we're going to move to the direction that we're all wanting to go, that's not going to be okay. It never should have been okay, but it really has to go in that direction. But that's going to take a hell of a lot of maturity, and a lot of people, even people that may think that they don't have, that they're above board, they've never had issues. It's going to take a lot of really digging into our hidden racism, our hidden sexisms, our hidden to come out of that, be safe to come out of it, and then move past it. So how do you look at that kind of a situation?
For me, Kristin, I really look at it as like all the isms, for as far as we have come, we definitely have some way to go. I also know that people also have their own personal stories, that it's not always a generalization of each situation. So for me, I know that I have this persona and look really young for my age. It's not a compliment or something, but it's just when people see me, they're, oh, okay, maybe you're still in college or just graduating or something. And then I'm a light speaker. I'm not boastful in that way. So I lead quietly. And so when people, and then you're also a woman. Then on top of that, you're of color. Yeah. So the ands and the ands. So when you are speaking with someone who is a male who has this masochistic personified personality or background, traditionalist, then I think it comes off that way. And unfortunately, what you see a lot of is misunderstanding, a tendency to overtalk or be disrespectful or not, take someone seriously in the position or role that they're in. And I have been very blessed that I have a father who is all about, women empowerment. He's always wanted daughters. My mother is the same way. She always wanted us to always have the traditional skill set, the basics, but then more than that, so that we could always be competitive against anyone else and just be, well-rounded in what we know and of the world. Again, being able to live abroad and then come to the States, gave a different level of exposure and understanding of just people in general. And so that's why the position that I'm in now is because my parents, my father, was very adamant about, well, if we're going to put you in the front, I want to make sure that you have a title that speaks to that so that people know that the buck stops here. And that you also feel confident that when you're making decisions that you don't always have to, rely upon me to do that. And when you're speaking, on behalf of yourself or the company, that people know that they need to come at you in that way. Sometimes that can be a challenge, depending on, what type of person that is. But fortunately, I have been able to be blessed in that manner, and I'm very grateful for that.
I think too, it's interesting too to walk in the shoes of being someone that deals with things like that more quietly, or they have a more quiet nature, and rising to the challenge of being underestimated, which women know that very well, and then of course women of color know that even more so well.
Yeah.
So it's kind of interesting when you are that quiet one, you sit back and you just see all the BS that's kind of going around, and you go,
yes. Oh my gosh, yes. And we have seen it. We have seen it. There are no successful organizations that have not been through a living, what? Oh my gosh, yes. I mean, I just really feel especially in this industry, you really have to have a good team. More than anything, hire the right people. if nothing is learned from this conversation, other than that, I will be happy. Like, you have to have the right team. So start there first, because that will make things so much easier as you're going through these challenges and problems. And, you got to have people who are loyal and, just have great work ethic and are resourceful. So,
yeah.
Got to do it.
Absolutely. I mean, I looked at a lot of my time doing different challenging things I've done. I used to, rake myself over the coals for all these mistakes. And now I don't even look at them as mistakes. I go, I had some experience with filming things last year, and they could absolutely be classified as mistakes or missteps. And here's how I turn it around. I tell myself, I went to film school. I learned. Boy, did I learned exactly how you don't behave. I learned exactly how you don't treat people. I learned exactly what you don't take money from wonderful organizations and then put it into shady things. I mean, I learned so many things that it was film school for me. So now we can do, if we choose to do any more of that, we know who to work with that's above board. But how would I know it otherwise than going to my own type of film school? You know what I mean?
Yes, exactly.
And that's how we learn. And you picked such an industry rife with so many issues. That's what was fascinating to me. To start in 2018, I was like, wow, they are coming in really challenging time.
Very challenging time, especially financially. And we didn't really understand what that means in terms of being investors in this industry, and the how antiquated things are compared to other industries, especially the person who is very much in love with tech and wants that to be more involved. So even now I'm trying to figure out, how do we provide, robot process automation, to our systems, and working on a special project within our company to do that. So then that way, authorizations that take up too much people's time can be done, or, minute tasks. So then that way, a lot of our staff can really work on patient improvement.
Yes.
Exactly.
Yes.
It's too cumbersome, the stuff that is not patient-centered. And it's less time doing that.
It feels like sometimes, doing this as long as I did with the EHR consulting piece, it was like, oh my gosh, when do these wonderful people that are in this field get to actually be counselors?
Right.
It's so antiquated. Every other sector of healthcare, well, not every other, but every other large sector of healthcare has better tools than mental health. I mean, what on earth? It was an interesting journey.
Yes, it is. And I'm excited about seeing some of the changes that are, happening in terms of, more patient-centered care, going from fee-for-service, to, quality of care, making these different changes. And hopefully that also trickles down to insurance, and just more,
all of that,
healthcare for everybody, so that they can get access to these things. It's very much needed, and there's just a lot of work that needs to be done on the insurance side and things like that. But I'm glad to see, in terms of how people are looking at care, that it's being more fully integrated, and especially for those who are receiving medication.
Yep. Yes, exactly. And I love that you're doing it where You're not saying, oh, this is the way, the holistic way is the only way, or the Suboxone methadone is the only way. You are, like you said, meeting the patients where they're at. So if you
Right.
want to go the acupuncture or a combination of, we'll
Right.
work with you. That's definitely unique.
Yeah, we have to. I mean, just because, just coming from our own background, one of the things that I've learned across this journey was medications or services like pharmacogenomics, and having care that is specific to your DNA makeup. So it's just like, if that's the road that we're going to take, where we're going from less general, then across the board, we really need to be thinking about how can we be innovative and making sure every patient that comes to that door, they're getting the care that's specific to them in their therapy, and medication, that's what they decide to do, physically as well. So taking those courses and those tests to understand how they metabolize different medications that they are being given, even if it's not to do with addiction.
Right.
To cancer, cancer genomics, there's a lot of different things that when you are dealing with addiction and mental health, that just affects you in so many different ways. And so we want to make sure people have those options, and then we're not missing something. So then all the providers can make informed decisions, and the patient knows what is going on. It's unfortunately just the statistics of, women and especially Black women in terms of what kind of care that they're given, even just in the regular hospital space. There's a great comic, Wanda Sykes, makes mention of this on her comedy special on Netflix, just about how, unfortunately, a lot of people do not take certain ailments that they may be feeling seriously. And so they die, they get diagnosed with something that could have been diagnosed or treated earlier on. And so all of us, regardless of background,
like the woman who it was just on my news feed the other day, African-American woman died in the waiting room waiting to get treatment in an emergency. So I was like, what on? You say what on earth, and then you remember, right, we're still in the dark ages in many ways. Yes, we've come far, but way not far enough.
Yeah.
But it's still like, why is this happening? Exactly.
And so for all Americans, we really need to make sure that we're not just generalizing things. But because I'm on the business side and seeing the investment it takes to do it, I understand why people do that. And that means that there needs to be some more conversations about the regulation and when they make changes that affect, the fee schedules, the things that people need to be able to provide these services. When states decide they're just going to bundle something, not knowing that it could affect the level of treatment somebody else can get in these other innovative approaches to medication. So it's just like, that's why you're going to get more of the, I'll just do barely enough, I will take advantage of the system people, because they're not going to give the full care. So that's where those people, who are not doing what they're supposed to do are going to do those things. And there's not to say that people don't take advantage, but I think if more regulations, regulatory agencies and private sector, nonprofits can get more together, legislators, to have conversations and not just, have these stigmas or have these preconceived notions about what they're hearing from just one side of the community, and come together, then I think that we can make some changes as to things that can benefit the patient, make sure that the cost has, been simplified for those who are trying to invest to make these options available for patients just easier.
Absolutely. That's why I loved, segmenting out a show that's about the business side of healthcare in mental health, because there's this outrage, as it should be, about, well, I've heard it from people that work for a treatment center, and, well, this treatment center is doing shady things, or they're not paying. They hired me and then they cut my hours, and it's just their fault, and they're this. And I always think, okay, that could all be true. And is it also that they were cut somewhere, and funding wise, do they have enough patients to keep you working 8 hours a day? Maybe they cut you back because, I understand all, even so do you. So there has to be this conversation on both sides. It's not just, oh, the man, quote unquote, is keeping me from doing my job, and no, it's not about that. There's so many factors.
Exactly. And the transparency, and we're very transparent with our staff when it comes to that. Like, hey, this is where we are. This is where we need to be in order for us to get to the benefits, or get to, these other things we want to do, for you guys. And that's, highly needed, on the employing side, but on the actual fee for service and, these fee schedules and insurance providers, Medicaid is pretty good, and Medicare does really well in terms of making sure people get, the services that they need, but not everybody qualifies for that. And then also, you have private insurance, and sometimes that can take, 3-6 months sometimes before a business gets paid. But of course, you have payroll. So
that's right. And it's just like,
I don't think, right. And I don't think everyone always thinks about, all those things that come into place. They're just like, oh, I know you guys have X amount of patients coming to the door every day, so you guys are making money. But like, we had to wait.
Drive up in a Ferrari? I don't drive up in a Ferrari.
Exactly. Right. Exactly. So just like, and we're not doing the gas and go situation. So we're not just having people come in, get medication and leave out. We're actually doing therapy as well and other things. And we have people that, don't come in with no insurance, and we still treat them. So, it's just like all these things and above. And if you're working within areas like we are, most people only have Medicaid or Medicare, and those fees are, only maybe a third or 25, a quarter of, what you would get from private insurance. So, and even though you might be being paid more frequently, it's still not enough always sometimes to cover payroll. So you got to make sure that you are financially sound and being able to do those things. And not everybody can.
Yeah, it takes a lot of investment, and that's investment of funding and time. So absolutely. I mean, yeah, I so appreciate you coming on and talking about the brass tacks of everything. Can you tell my listeners where they can find out more about your organization?
For sure. Thank you, Kristin. You can find Omnis Health Life Wellness Center information at our website. That's www.omnislife.com. That's OMNIS life.com, and find more information about us, our phone numbers, and all of our services.
Fantastic. Well, I am so glad that we are getting to work together on some projects, and thank you so much for coming on the show.
Thank you, Kristin. I really do appreciate it, and thank you to all your listeners as well.
Absolutely. Listeners, thank you for tuning in to another episode of Mental Health Business on Mental Health News Radio.
Sometimes I'm passive-aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song Cordial for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it.
Good boy.